It's the February 2024 show with Lill from CMHA. I always have such a great time talking with you, Lill. And last month, I just want to give you a quick update. We did a piece on homelessness, really resonated within the community all over. It's such a big issue, and I want to thank you for taking the time to sort of help explain what some of these folks are going through. I think it's critical, don't you, that we keep this conversation going.
Absolutely. It's a very important conversation.
And we don't know what everybody else is struggling with, and I think that's the important part that we need to know, which leads me to my question this month.
Mhm.
Um, you encouraged me a long time ago. I was sort of doing some research on psychosis. I didn't really understand it, and you said, "Well, I think we had a conversation about it." But then I researched it, and I understood a lot more. First of all, for the general public, what is psychosis? You hear people having a psychotic episode, but I
Mhm.
don't think people understand what it is.
Right. So it is a break from reality, right? You could have disorganized thinking, disorganized thoughts. You can see things that are not there, hear things that are not there, smell things that are not there. So it is a break from reality, hallucinations and delusions that are very real to the person experiencing it.
Wow. Now, with such high numbers with mental health struggles within our country, I think 1 in 4 is the ratio these days. So you're going to come across folks in the general public that maybe are struggling a little bit. Um, if you're seeing someone, if you're out on the
Mhm.
street and you see somebody having an episode,
Mhm.
what are you supposed to do? Like, what am
Right.
I as an average Joe? I mean, I'm kind of afraid. I don't want to get involved. I don't know
Sure.
this person. What would you recommend?
Well, there's two factors to that. So working with a person that you're interacting with, or just passing somebody by. So if you're passing somebody by, and we've all seen that person that is talking to themselves, dancing in the middle of the street, laughing in the middle of the street. I work downtown, so I see it all the time. That person is quite harmless, so we just walk on by and unless the person seems in distress. I've seen people laugh at individuals. It's very sad, but this person is having a break from reality and is probably talking to someone in their head or just seeing things that are not there. So I think it's really important that we don't laugh or mock this people that we see on the street that are exhibiting this type of behavior. If you're working with someone or know someone that is experiencing a psychotic episode, we need to remember that what they're seeing, feeling, experiencing is very real to them. So the last thing you want to say is, that's not there. Like, there's nobody there, right? That's not happening. It's just all in your head, right? It's very dismissive and it will serve to agitate the person more because what is happening to them is very real, even if you can't see it happening. So it's good to keep the person in a safe place, have them sit down, and just listen to them, right? And tell them, I believe that you believe this is very real. We often make the mistake, people who aren't trained or have never experienced this before and don't know what to say or do. We often say, well, that's not happening. There's no one there, like the wall is not dripping blood, right? But it is to them. So we have to remember to not dismiss it and just let them know that they're safe and keep them safe. Also, do not touch the person, right? They're highly agitated in a psychotic state. So the best thing to do is sit them in a place and just sit with them and just let them be until they're feeling better, get the help that they need. But never be dismissive. Yeah.
Is it just sort of helping them come down? Is it like, I don't, calming words? Like you said, you're almost in agreement, but at the same time, you're trying to bring
Yes.
that
Yes,
psychotic level.
definitely. You want to get them unagitated
Okay.
and you want to help them feel safe because often in a psychotic break, it's very scary for them, very frightening. Sometimes it's the opposite. The voices or what they're seeing is a friend to them, right? It's giving them advice. But more often than not, it's a scary experience for them. So you want to make sure that they're feeling safe in a safe environment and not threatened.
One of the things I read on that course I did was that you can have like literally one psychotic episode in your life, and that's it.
Yes,
Like
yes.
it's just, it can be like you said, that something happens and that switch
Yes,
is turned off.
right.
Maybe they're off their medications, maybe something, an event occurs.
Hmm.
Um, so it's not like it's something they do every week, but it
Exactly.
can slowly get worse if it's not addressed, correct?
Yes, and there are EPI programs, early psychosis intervention programs, that are
Oh yeah.
specifically for that purpose. For your first episode, you'll get the treatment, and you may never have another one again, right? So,
How do you recognize? How does someone recognize if they feel suddenly they feel uneasy? They hear these voices. They're not sure. They
mhm,
don't want to say anything to anybody. Like,
mhm,
what would you recommend to somebody? Like, how do you cope with that? Like, how do you make that next step to getting healthy again?
mhm. Well, definitely psychiatric intervention is needed, or into the programs that are being offered by the Brant Community Healthcare System in partnership with us. And just to really get that treatment it's a multidisciplinary team, and you will get all the assistance that you need in every component to keep you well and make you well.
I know this is sort of a reaching question, and I know this is probably not answerable, but I'm going to ask it anyway because that's what I like to do to you, put you on the spot. Is
Never.
there, does it, like if somebody's having a psychotic episode, does it usually have a background that's something that happened years ago? Like, what is the basis that starts this?
And that's a really good question, and you're right. That's an unanswerable question, right? We don't we don't always know what triggers psychotic episodes, but we do know that it is a break from reality. So if a person may be triggered for for whatever reason, or it may be memories. It could definitely be memories that are coming back as a trigger. And, definitely we never know what's going on in a person's mind during a psychotic episode, but we definitely know that, there is some sort of trigger or memory or situation or fear or threat that can bring one on.
Ah,
Yeah.
I got you.
Yeah.
So yeah, you can, when those other situations occur that maybe
Mhm.
suddenly you're having an anxiety
Yes.
fear of something, it can
Yes.
bring on the secondary stage of psychosis.
It can. And
Wow.
sometimes there's no reason at all. It could be drug induced, right?
Yeah.
Sometimes when you're mixing those really hard street drugs, pardon me, it could be a drug induced psychosis. And we've seen cases of that too. So, there's many factors, and that's a really tough question to answer, but it's good to know a little bit about it,
Yeah,
right?
for
Yeah.
sure. Statistically, I mean, obviously we haven't kept records for a really long time, but is it on the rise or are we feeling like we're getting a better handle and people are recognizing it earlier?
I think people are recognizing it earlier, which is a good thing. As you said, if you get the treatment, or you could just have one episode and then you're done and done. Or, it could be ongoing, and that's where psychiatric help is important, and monitoring with types of medication to keep you sort of on the stable level.
And like you said earlier, I mean, if someone feels like they're having that, they can always reach out to you guys at CMHA, correct?
Sure. I mean, our clients, we serve severely mentally ill, and those with schizophrenia, bipolar, and other schizoaffective disorders are certainly on the population that we serve. So absolutely, reach out to us. Yeah.
So someone, last question, I know I'm keeping you and you've got meetings. I'm sorry. I'll just apologize now. If someone is diagnosed as bipolar, does the psychotic episode happen before the bipolar happens? Like, I don't, I'm
It's
just curious in there.
right. So what happens is with bipolar, it's a while before it can get effectively diagnosed, right?
Oh,
And it could be psychotic breaks. You could have psychosis. So that's an illness that it takes a while to diagnose.
I
So
got,
I would say that before there's that diagnosis, there's a lot of the symptoms that happen before. Yeah. And it
uh,
is definitely, psychosis can be a part of bipolar disorder for sure. Yeah.
it's always an interesting, it's fascinating. Since we started doing these shows, it's just always, the learning curve is so big and we're seeing such an upswing. You and I have talked about it during the pandemic and everything, just people's mental health is so important. And thanks for doing these. I mean, I really appreciate getting, understanding better. And I think that's knowledge is power, right? And
I
if we can
totally
educate
agree.
folks watching our videos to see okay, you know, just be aware, right? Or here's how, like you said, not touching and being calm and
Yes.
understanding.
Yes.
All those critical points I think that people need to realize. Can't thank you enough for doing these, Lill. Take care. Can't wait to see what we're going to talk about next month. I'll surprise you with some questions. I'm always trying to catch you, but you're always prepared. Dang.
It'll be great. Whatever we do.
Take care. Look forward to seeing you next month.
Thanks, Dave.